Hey everyone, welcome back to Graft Academy. Today we're talking about something that can make a lot of patients anxious. What happens if your bone graft is healing too slowly? If you've had a graft done and your dentist says it's taking longer than expected to heal, it's natural to worry. But here's the truth. Slower healing doesn't always mean something is wrong. It simply means your body is moving at its own pace. Let's go over what causes this, what your dentist looks for, and what can be done if your graft is taking longer to mature. First, remember that bone healing is not a fixed timeline. Most grafts take 3 to 6 months to integrate, but some take 9 months or even longer. The body's process of replacing graft material with living bone depends on hundreds of small factors: blood flow, health, material type, and even genetics. If one of those factors slows down, the whole process can stretch out. One of the most common reasons for slow healing is low blood supply. Bone grafts rely on new blood vessels to deliver nutrients and cells to the area. If the graft is large or if there's limited circulation in that part of the jaw, it can take longer for those vessels to form. This is especially true in the upper jaw, where bone tends to be softer and less vascular. Another reason is the type of graft material used. Some materials, like bovine or synthetic grafts, are designed to resorb slowly. That's not a problem. In fact, it's intentional. They maintain shape and volume longer while your body gradually replaces them with living bone. But that means they'll take longer to look healed on an X-ray compared to an autograft or allograft. General health also plays a big role. Conditions like diabetes, anemia, or low vitamin D levels can slow bone metabolism. Even stress, poor sleep, or inadequate nutrition can delay healing without you realizing it. Your body needs energy and the right nutrients to rebuild bone. Smoking is another big factor. Nicotine constricts blood vessels and limits oxygen delivery, which can delay bone formation for months. If you've quit recently, that's great. Your body will start healing faster right away. So what does your dentist do if your graft is healing slowly? The first step is monitoring. They'll use X-rays or a 3D scan to check bone density and structure. If the graft appears stable, shows no signs of infection, and the gum tissue is healthy, there's usually no cause for concern. It just means you'll wait a little longer before moving on to the implant. Sometimes your dentist may use biologic enhancers to help the process along. That could include PRFA, platelet-rich fibrin, or bone-stimulating membranes that release growth factors over time. In some cases, low-level laser therapy or ultrasonic stimulation can also promote faster regeneration. If the graft isn't integrating properly, meaning parts of it aren't turning into living bone, your dentist might recommend a small revision procedure. That doesn't mean the entire graft failed. It simply means they'll add a bit more graft material to fill in the slow healing areas and restart the process. Revisions are usually simple and heal well once the biology catches up. It's also worth noting that slow healing looks different on scans than it feels in your mouth. You might feel fine, no pain, no swelling, but the bone still needs more time to reach the right density for an implant. That's why imaging is the only accurate way to judge graft maturity. If you're waiting for an implant after your graft, think of this as a good sign. Your dentist is being cautious and patient, which means they're prioritizing long-term success over rushing the process. Implants placed too early in soft bone are more likely to fail, so taking extra time now prevents problems later. So how can you help your graft catch up? Maintain great oral hygiene. Eat a balanced diet rich in protein, calcium, and vitamin D. Avoid smoking and alcohol. Stay hydrated. And get regular follow-ups so your dentist can track healing progress accurately. To summarize, a slow healing bone graft doesn't mean failure. It usually means your body needs more time or that the graft material is designed to resorb slowly. As long as the area stays healthy and stable, the outcome will be just as successful. It'll just take a little longer to get there. Patience is a big part of successful bone regeneration. With proper care, even slow-healing grafts become strong, healthy bone that lasts for decades. If you found this video helpful, make sure to like it, subscribe to Graft Academy, and share it with someone going through the same experience. We post new educational videos every week to help you understand modern dentistry in simple, clear language. Thanks for watching, and we'll see you in the next episode.